Measles, a highly contagious viral disease, remains a significant public health concern in low-income countries like Ethiopia, particularly in the Amhara region. Despite ongoing vaccination efforts, periodic outbreaks continue to occur. This study aims to investigate the temporal and spatial patterns of measles in the Amhara region from 2019 to 2024, providing insights for targeted interventions. Background: measles is one of the most contagious vaccine-preventable diseases, primarily affecting children. Before the measles vaccine was developed in 1963, it caused an estimated 2.6 million deaths annually. While the vaccine has significantly reduced measles incidence and mortality, the disease remains endemic in many low- and middle-income countries, including Ethiopia. In Ethiopia, measles outbreaks persist, especially in areas with low vaccination coverage and high population mobility. The Amhara regional state has experienced a high burden of measles, with confirmed cases rising over the years. The region's diverse topography, including highlands, lowlands, and plateaus, influences climate, population distribution, and access to healthcare services in remote areas. Study objectives: this study aims to assess the incidence, temporal trends, and spatial clustering of measles cases in the Amhara region from 2019 to 2024. By understanding these patterns, the study aims to inform targeted interventions and outbreak responses. Methods: a retrospective analysis of regional measles surveillance data from 2019 to 2024 was conducted in the Amhara region. The study utilized enzyme-linked immunosorbent assay (ELISA) for measles confirmation, employing the Euro-Immun test kit. Descriptive statistics, trend analysis, and spatial analysis were performed using SPSS and ArcGIS tools. CT-scan statistics identified significant primary and secondary measles case clusters. Results: out of 18,468 reported measles suspected cases, 11,354, 61%, were clinically compatible, 3,657, 20%, were epidemiologically linked, 1,886, 10%, were discarded cases, and 1,571, 9%, were laboratory confirmed. The highest proportion of cases, 36.5%, occurred among children aged 5 to 14 years, followed by adults aged greater than or equal to 15 years, 26%. Males accounted for the majority of cases, 54%. Geographically, the highest number of cases were reported from Wagimra zone, 16.6%, followed by Central Gondar, 12.4%, Oromo Special Zone, 9.6%, and East Gajam, 9%. The crude incidence rate per 100,000 population increased from 0.53 to 2.13, peaking in 2023. Measles cases showed seasonal trends, with peaks during spring, March-May, and autumn, September-November. Spatial autocorrelation analysis indicated clustering of measles cases, with hotspots identified at the Warita level in Wagimra, Oromo Special Zone, South Gondar, and North Shoa zones. Conclusion: measles transmission persists in the Amhara regional state, with increasing incidence and distinct spatial and temporal patterns. Immunity gaps in older children and geographically clustered outbreaks highlight the need for enhanced vaccination strategies. Strengthening measles surveillance, prioritizing catch-up vaccination for older children, and implementing targeted immunization campaigns in hotspot areas during peak transmission seasons are recommended. Implications for public health: this study provides valuable insights into the epidemiology of measles in the Amhara region, Ethiopia. By understanding the temporal and spatial patterns of measles cases, public health officials can develop targeted interventions to control and prevent outbreaks. The findings emphasize the importance of maintaining high vaccination coverage, strengthening surveillance systems, and addressing immunity gaps in older children. Future research: further research is needed to explore the specific factors contributing to immunity gaps in older children and the effectiveness of targeted immunization campaigns in hotspot areas. Additionally, investigating the impact of cultural and social factors on measles transmission and vaccine uptake could provide valuable insights for tailored public health interventions. Takeaway message: measles remains a significant public health concern in low-income countries, and understanding its temporal and spatial patterns is crucial for effective intervention strategies. This study highlights the need for enhanced vaccination strategies, targeted immunization campaigns, and improved surveillance systems to control measles outbreaks in the Amhara region, Ethiopia.